For those of you who've been watching me for a while, you may remember me saying things like, man cannot live by bread alone and neither can women. And I'm trying to talk to you about how to expand your practice, how to build a practice, because what my point is, hey Victor, how are you? Let's go to wave to Victor. You can't be a one-trick pony in this business, right? There's a lot of talented people. There's a huge demand. And, honestly, not to sort of belittle anyone, but everyone does neurotoxins and fillers. And if that's what you're doing, you really need to differentiate yourself, because you can literally go from here, in any direction, 10 steps, and you'll find 10 more people who are doing what you do. So it's great to do those things, and nurses are really comfortable with injections, but to be really successful, you have to go outside of your comfort zone. And I know when I first started, oh, by the way, we have a very special guest star who's going to be on our show tonight. She's has to ask to join us, but in a little while we'll have her come on. Her name is Lindsey. Good to see you too, Victor. I feel like I haven't seen you forever. Hopefully you guys are all doing well. But when I first started in practice, I recognized that I had to diversify, right? So I was just doing surgery, and if I didn't show up for work, no money came in, there was no revenue being generated. It was a one-man show, and everything was on my back. And I realized early on when someone approached me about this idea of this new concept, it was called laser hair removal. And it was a foreign concept. This was in the early 1990s. No one was doing it. And I sort of figured it out that I would let them try to do it in my office, and they would, we would do some revenue splitting, and we would figure out how to share the patients, and they would send me patients for liposuction, I would send them patients for laser, and it kind of started that way. And within a short period of time, I realized the concept to being successful was to sort of have what I call one-stop shopping, so that you could come to my office and you never had to leave to get any other procedure done, whether it was laser hair removal or vascular or or pigment, or a facial, or skincare products, or liposuction, any procedure, any device, any new technology, we would have it. So I never wanted to lose a patient because I didn't have a device. I didn't want to lose a patient because I couldn't deliver a service. And I wanted to have, an upstairs med spa, which we do now, and my downstairs office. I wanted to have people doing every possible thing in aesthetics to bring us to the highest standard, right? So that we could never lose a patient. So those of you, hi Greta Hall, good to see you. You're becoming a regular, Greta. We're going to have to start calling you one of our posse members soon if you keep this up. Nurses, and most of the people listening are nurses and physicians who are getting started in the business, and it's really important to diversify, right? Not only because you want additional revenue streams. I mean, let's face it, a single individual can only do so many injections and so many patients in a day and keep up your level of expertise for so long before you just get so tired and you kind of plateau, right? So you need some help. You need someone to help you do other things that you don't do. You need to have an increased, a menu of services, and you need to have other revenue streams so that you don't have all the pressure, so you can take some time off and still have your practice creating revenue for you so that you can enjoy those pina coladas on the beach or whatever you like to drink.
We have the request, so just let me know.
We have a request. Oh, so Lindsey, let's let you in. So I'm going to split the screen in a second as soon as Maddie figures out how to do this with a very beautiful woman who works with us. Her name is Lindsey. And the idea for us is that, if you're doing just neurotoxin and someone wants laser hair removal or skincare products or diamond glow or hydrofacial or chemical peel or cool sculpting. Hello, I'm going to introduce you in just a second. Thank you for joining us. I'm giving a big build up to you. So they need these treatments, and they go to the spa down the street from you, and they do laser hair removal or they do cool sculpting. But they also do neurotoxins and fillers, so I'm not going to go back to this other spa and keep trying to go to different places to do my business. I want to go to one place that has all these services. And people literally have lost patients quite easily that way. So my advice to you, and again, most of you are nurses, I'll explain Lindsey in a second, is to create a way to do this. And you need to find someone who can do some of these treatments that I mentioned, right? Nurses generally are not taught anything about the skin. They're not taught about skincare. They're not taught about skincare or physiology or histology of the skin. They're not taught about hair. You don't know about lasers as part of your training. You don't know about peels, skincare, any of these things, right? And it's just not part of nursing training. And when you go to these courses, all anyone wants to teach you about is injectables, and that's important. But that's one thing, right? It's a much bigger thing. So how do you find a person that can do some of these things for you that doesn't have to be a nurse, that can work somewhat independently, and can create all of these things for you, diversify your services, fill up your menu of services, create revenue streams for you so that you can drink pina coladas on the beach in Florida, which is where everyone, I guess, is going now. So tonight we have Lindsey Demerit, who is an esthetician, and she'll describe a little bit of herself in a minute. But she works in my office, and I thought it would be useful to you, those of you who don't have estheticians in your office, to find out about what Lindsey does, to find out what her passions are, why you need someone like her, and her true value. So Lindsey, welcome. Thank you for joining. Tell us a little bit about yourself in terms of your history and how long you've been in the industry. Tell us a little bit about what you do and why you're so important to our practice.
Sure. Hi, everybody. Happy New Year. I hope everybody's healthy. Happy to be here. So I've been an esthetician for 12 years. I would consider myself more of a medical esthetician for the last 10 years. I've worked with Skin Medica products for 10 years and worked in more of a medical spa setting for about 7 years, transitioning into a dermatology practice for 4, and then now I'm working at Dr. Russo's Cosmetic Center for the last year and a half, almost 2 years. So it's been a progression for me, but I'm very happy to be in more of a medical environment. I think that what I bring to the table is I support the staff with skincare. I can help with discussing skincare products that maybe partner really well with the treatments or procedures that they're doing. I can meet with surgical patients to go over skincare that may help to benefit, or even treatments that may help to benefit or prolong the life of their surgery and their treatments. So I offer everything from facial treatments with Diamond Glow, hydrofacial. I offer chemical peels, skincare consultations when needed, so I can support a nurse who maybe has just done injectables and their patient has some questions about skincare and they don't have the time in their schedule. They've got 15, 30-minute slots, and they want someone, who can discuss skincare and is passionate about skincare. And that helps to build more revenue. That helps to build another form of a relationship with your client and patient and keeps them coming back. And if you choose good quality medical grade skincare lines, then they're not going to be able to be purchased in drugstores. They're not going to be able to be purchased at department stores or Ulta or Sephora, and they're going to have to come back to you or maybe purchase through an online store that you start. So it can be really beneficial to have an esthetician on staff who can support that. Even if you were just starting out and you wanted to bring in an esthetician maybe part-time, or maybe they would be willing to work for you as reception or a patient care coordinator at the beginning, and could start out that way as you're building your practice. A lot of times estheticians may not have started out in a medical setting, but would love to start out in a medical setting. And so this would be a good opportunity if you get the right vibe from someone and you feel like they really are passionate about medical aesthetics and willing to learn, then I think that that would be a great way to support your practice and your business.
Lindsey, most of the people in the audience probably don't know a lot about what estheticians do. Thank you for kind of detailing that for them. How do they find someone like you? And if they do find someone, how do they know if they're any good, and what can they do?
So I think it's important to network. I think you could always speak with other nurses. You could speak with product reps to find out if there's any estheticians who've reached out to them. Because a lot of times, the product representatives will know of estheticians who are looking to transition or find a new position. Also, you could reach out to of the local aesthetic schools. There's Catherine Hines.
Mhm.
I myself went to Spa Tech, which is another local school. I'm not sure how much Elizabeth Grady is around anymore, but I think that would be, another option. And I think it's important to meet with the esthetician, discuss with her what she's done, what she hasn't done, what she feels comfortable with. Would she be comfortable with being in an environment where there's syringes and needles and toxins? And what has she learned in school already? What does she feel comfortable with? He or she, I should say.
Yeah, right.
Try to find out if they're passionate about that type of environment. I think that, a lot of times in school, we learn a bit of the basics of everything. And hopefully you're able to figure out, what you're passionate about through the schooling. But sometimes it's more finding that right fit over time. So you may find someone who's worked more just in a spa setting, but realize they have a passion for medical aesthetics. And I think if you're willing to train them, or if you're bringing on devices and you're willing to allow that provider to train on that, then you could see great success.
And you're kind of at the top of your game after 12 years. You've probably seen and done, pretty much everything an esthetician can do. Can you tell the audience, what in your mind are your kind of best procedures? What procedures do you think, in your own mind, give the best results and create the happiest patients? Because there's a lot of devices out there that I don't think do very good jobs and, really kind of are more like smoke and mirrors. But after all these years in the industry, what do you think give the best results? What are you most confident, treating a patient with, because they're going to get a good result and be happy?
So I would say if we're looking at facial treatment, I really kind of marry the idea of doing something like a diamond glow or a hydrofacial, depending on the patient's skin type, and combining that with some element of relaxation, because I think that a lot of times patients are still seeking some of that even in a medical setting. But in terms of chemical peels, I love the Skin Medica chemical peels. I think they yield a really nice result when done in a series, as well as the VI peels are great to have on hand for some specific concerns or for patients who have kind of outgrown single acid peels. I've also seen great success with Clear and Brilliant preventative patients, or as part of a combination therapy. And skin pen and microneedling has been a really great treatment for me as well. I've seen a lot of improvement in acne scarring, post erythema with microneedling, shrinking the pores for a while, minimizing pores. While we can't change our pore size, these treatments help to refine that, and that's often sometimes what patients are seeking. So I do a lot more of cleaning the skin, preparing the skin for some of our more advanced treatments, is Morpheus or IPL if someone's looking to work on pigment, some of our laser procedures. So, I think that I've seen great success with Diamond Glow, Clear and Brilliant, hydrofacial. Those are great devices, as well as chemical peels and skin pen.
So you must have certain combinations of skincare products that, for example, would work really well with a Clear and Brilliant versus, microneedling or that sort of thing. So you must have a sort of a program or some sort of formula for which skincare products go well with certain treatments.
So ideally, if you're meeting with a patient in consultation, you would discuss with them what they're currently using, what they're happy with, what they might want to change. And then you also would want to take a look at what kind of ingredients they're already using, so that you can suggest maybe stopping some things prior to procedure, or starting on some pre-care to kind of prep the skin for a treatment. And then from there, you also want to prepare them with accurate post-care. So you wouldn't want any of your patients using things that could irritate their skin post-procedure. And oftentimes you go over
Mm-hmm.
that many times with them and they still may make an oops, but you
Yeah.
kind of
Yeah.
set them up for success, even with printouts or things that they can take pictures of so they can have reminders. So yeah, there's different skincare that I would provide for each type of treatment, and I would really tailor it towards what the goals are of the patient and also what would give them the best outcome with the procedure.
And
So
I think, I'm sorry, go ahead. I was just going to say, I think many people in the audience don't realize how valuable the skincare is, not only as an additional revenue stream, but just, if you're doing neurotoxins and fillers, you can make the skin just look so much better, and it makes the results of your neurotoxins and fillers look so much better. And it's a good starting point. Most of these devices that you mentioned are relatively inexpensive. There are some disposables, I believe, with most of them, if not all of them, but the cost is relatively low. And the results are pretty amazing for the amount of money people are spending. And I think that, at least in my mind, it's kind of a no-brainer, right? That you should be selling skincare products, not only because there's a revenue stream associated with it, because it just makes everything better, and people want to come back to you because they see that their skin's better, right? And that's something they should never stop doing, even if they do other procedures. Do you agree with that?
do agree with that. I think it builds a relationship. It shows that you feel comfortable making suggestions, or you're looking over at their skin and seeing kind of things that you think would be helpful in managing care. One example I can think of for injectors just would be even something like HA5 from Skin Medica.
Yeah.
Their
Sure.
injectables, most of them are made of hyaluronic acid. So you can kind of learn about the hyaluronic acid from Skin Medica and how applying that topically on the skin is going to instantly plump and hydrate the skin and make the skin look smoother. But also it's helping support the natural hyaluronic acid in your skin, so your skin is getting better and better over time, better hydrated and healthier looking. So that would be, just a gateway that even an injector could use in their treatment room as a starting point for even passing them over for a full skincare consultation. So it is really beneficial, and it creates that relationship.
And I think one of the things that patients who are, in their late 30s, early 40s, that, starting, always start to see these fine lines and wrinkles, right? So not enough that you would want to do any kind of surgical procedure or an aggressive procedure, but enough that it bothers them. They've got, their Irishy, Englishy, Scandinavian skin, thin, easily damaged, hypervascularity, pigmentation. How do you treat those patients? Are there procedures that you think are particularly good for fine lines and wrinkles? Are there chemical peels that are better? Like, what's your approach on that kind of patient?
So I think you would definitely start with some skincare. You could consider some growth factors. So TNS Advanced Plus Serum from Skin Medica. You would want to maybe consider Lytera, which is a pigment correcting serum from Skin Medica that can help with more of the hyperpigmentation, freckling, discoloration patients get starting as early as their 30s. And then you could also consider a retinol, which is going to be a vitamin derivative, which is going to help with fine lines, pore size, texture. That covers a lot of bases, and I would probably put that in with maybe starting out with a facial treatment, so you could address their concern and clean their skin, and then from there it could be IPL is the right choice for them because the main concern is pigmentation. It could be doing something with more of a vascular laser to kind of clean up broken capillaries or areas of diffuse redness. You could utilize something that's more, preventative or firming of the skin. So you could look at something like Soft Wave, which I know is an intense ultrasound treatment that we offer at the practice, and recently did a little event at the school on. So there's all different options, but you could definitely start that patient with just a facial and some good skincare, and then bring them back or create a targeted treatment plan that maybe lays out a series of different treatments over a course of time.
Okay, that was excellent. Thank you. So if any of you have questions, please send them in now. Dr. Lynn asks, what products should be in a medical grade skincare line?
So, I mentioned Skin Medica, and I mentioned there's also SkinCeuticals. Those are a couple of lines that are available to providers who are in the network. And those are great skincare lines because they're backed by science. They're not readily available to your patients in the drugstore or at a department store. They're going to come to you exclusively to buy those products. And they're rooted with science. So Skin Medica's got their TNS Advanced Plus Serum. That's, one of their number one products, and they're rooted around growth factor, which is helping to stimulate collagen and elastin. You've got SkinCeuticals, which is more an antioxidant based company. They're looking at vitamin C and how that can make changes in the skin, ferulic acid, vitamin E. So, I would say that through the network, you're able to access those lines and get the Skin Medica chemical peels, VI peels as well. So those would be places that I would start. There's obviously other medical grade skincare lines that are available. You always would want to do your research and look to see if it stands for what you're looking to achieve with your patient's skin.
For those of you who are joining us, we're talking about why you need an esthetician in your practice. We're talking about why they add so much value to your practice, both in terms of creating an additional revenue stream for you, expanding your menu of services, and being able to produce revenue for you when you're at the beach drinking. We keep saying pina coladas. I don't know why, but pina coladas on the beach. And Lindsey's the esthetician in my office. She's got 12 years of experience, and she's giving us like this whole breadth of experience and telling you why you need her or someone like her to work with you. So, Lindsey, if I said to you, and by the way, if you have any questions, please feel free. Dr. Lynn, you're welcome. Ask any questions. She knows everything about aesthetics. But if I said to you, Lindsey, we're going to send you to a deserted desert island for the next few years, and you can only take 3 devices with you for those 3 years to treat patients with, what would those 3 devices or procedures be?
Well, first would be a product, of course, the SPF, because if I'm going to a deserted island, I'm going to be drinking pina coladas, I have to wear my sunscreen. So that's
okay.
The number one response for any esthetician, or it should be. But in terms of devices, I would probably say I would bring my Diamond Glow device because I could keep my skin exfoliated and hydrated and my pores clean. I would have to say Clear and Brilliant because I'm going to be kind of constantly around the sun. So I want to be fixing any sort of damage that's creating and, preventative maintenance. And then obviously aging doesn't stop. We're trying to stop it. So I would probably bring Soft Wave with me.
Oh, nice.
I could kind of keep lifting, creating collagen and elastin, working on any imperfections there. So
that was a little surprise. Do you want to tell our audience a little bit about Soft Wave? I know you were doing the demos at our school the other day showing how to use the device, but do you want to tell them? It's a new device, and I think it's kind of like the second generation Ulthera. But let me hear your thoughts about it.
Yeah, I never worked with Ulthera personally. So my only experience with ultrasound-based treatment would be to be working with Soft Wave. Although I had worked with a body contouring device that did utilize ultrasound, which was, but I found that with Soft Wave, you're working over the neck, you're working over the full face. It's non-invasive. Anybody can do it. It's very, very comfortable. either with numbing or Pronox, or some patients don't need any of that. And there's no downtime with the treatment. It's colorblind, so you can work on all skin types. And it's helping with fine lines and wrinkling of the skin. It's also helping to stimulate collagen and elastin. So it's doing a little bit of everything. It's touching on several notes of what patients come in seeking to work on. So,
and I think you primarily would consider it a skin tightening device.
Definitely skin tightening device. You're not going to see necessarily changes in any sort of pigmentation or broken capillaries. Like, it's not targeting that, but it can help a little bit with texture of the skin. Sometimes we see some texture on the chin, and it can help with that. But its primary focus is definitely skin tightening, which I think is definitely a popular request when patients they look for a non-invasive treatment.
On one of my last shows, I was saying that over the beginning of my 31st year in practice, and over the course of time, the Holy Grail hasn't changed, and the Holy Grail, in my mind, still is and always will be skin tightening. Right? Those things that can actually create skin tightening are getting you to the Holy Grail, because it's as we get older, we just our skin gets looser and a lot of laxity. And if a device like this is really helpful with skin tightening, you could use it all day long. It's really, really hard to achieve. Dr. Lynn said, what laser machines do you prefer, think are best for IPL and hair?
So we have in the office a combination of Dialase, which is an in-mode device for hair removal, and then we also have the Zeo laser, which is for hair removal as well. So a couple of different wavelengths. I personally don't think that IPL is the best form for hair removal. I find that different wavelengths are going to work better for hair removal. In terms of IPL, we have the Lumeka, which is part of the Zeo device, and from Cutera, and then we also have why am I blanking? InMode.
The Limelight.
Yeah,
Limelight.
the Limelight is from Cutera, and Lumeka is from InMode.
InMode.
We have those two as options, and both work well. It's kind of sometimes one may work better for one person than the other, or you may find one works better for redness, one works better for browns. So
Dr. Lynn, I think you'll find that IPL is better for pigment in vessels, brown and red, whereas the other devices that are laser based are really better for the laser hair removal, because they penetrate much deeper, much more energy, and they target the base of the follicle. But they're not colorblind, so you have to be careful of the skin type. Would you agree with that?
Yeah, I definitely would agree with that. I think that the broadband that you're getting from IPL can pick up on too many surrounding chromophores, so you'd really want to find a laser device that's targeting that melanin in the hair.
Someone's coming to our course. Oh, good. Dr. Liz coming to our courses. Looking forward to meeting us in New York City. Great. We're looking forward to meeting you. For those of you who want to train with us or join with us, go to the link in our bio, and you'll see Aesthetic Mentor, and you can see all of our courses and where we're going to be and what we're teaching and all the stuff we offer. And we'd love to train you, get you started, because we really want to elevate the level of medical aesthetics in this country, which is woefully bad. And we want to, I think we are the gold standard, and we just really kind of keep trying to get better. And when you meet someone like Lindsey and hear her level of, understanding of the industry and what she does, there's tremendous value in this. So, do you have anything else to say before we sign off, Linz?
Consider adding an esthetician to your practice. I think that it could help you with everything from skincare to other services that can grow your menu and make you more successful and stronger business.
Yeah, that's what it's about. So thank you all for joining tonight. I hope you learned something. We'll be back next week. I was supposed to do a 5 o'clock live demo tonight, but my patient no-showed me. Well, she called at 4:30 for a 5 o'clock show and said something about COVID. I don't even know. But I'm sorry. We'll try to do that. Well, next time we may just record it and play it in the slot so you can see my safe injection technique and and an assessment. I'll draw on the anatomy so you can see where the vessels are. It should be a lot of fun. So have a great week, folks. Kate, you're welcome. See you then. Be safe. Bye.